You can start and we'll work on that while you all are doing introductions.
Okay. Well, again, good morning and welcome to the panel discussion establishing a Black Lived Experience Advisory Committee at the Minnesota Department of Health. My name is Alfred Johnson, and I'm on the board of MIPIN. I've been part of MIPIN for quite some time. We are pleased to have our presenters here who are going to share some really good insights with you. I'm going to do some intros. So, first, we have Pearl Evans. Pearl Evans is a person in long term recovery. And what that means is that she's been in substance she's been substance free for the past 10 years. Her lived experience has been a driving force behind her journey into public health. As a seasoned community organizer with a background in direct services, her leadership is rooted in building trust by authentically showing up, putting a face to public health, and demonstrating a deep commitment to engaging diverse voices. She listens first, collaborates with communities before acting, and ensures that overdose prevention efforts are shaped by community input. Evans facilitates meaningful opportunities for those impacted by substance use disorder to have a seat at the table, believing firmly that they must be central to the conversation and co design of solutions. Evans champions the integration of community knowledge with academic expertise to strengthen protective factors and reduce risk within communities. Her trauma informed, equity driven approach amplifies the impact of funding that supports grassroots efforts, helping to remove bureaucratic barriers that often hinder progress. And through her prevention work, Evans fosters community healing by centering uh, lived experience, building trust and creating space for those affected um, to shape the solutions. She continues to model community engagement and is a foundational approach to achieving lasting health equity. So, welcome, Ms. Evans. And then we have Letitia Coleman. Letitia Coleman, founder of Survivors for Systems Change, is a nationally recognized leader in survivor engagement and leadership. She provides facilitation for communities of practice, survivor leadership initiatives, webinars, training, and consulting services to government agencies, funders, nonprofits, and other stakeholders across Minnesota and nationwide. She has a unique strength for getting people with lived experience to the table, making them feel comfortable, getting them involved in ways that feel meaningful, and bridging gaps between marginalized community members and systems. She organizes her work that diversity, equity, inclusion, and decision makers are at multiple levels within systems and communities are essential to creating meaningful change. She believes you have to be involved in making the change you want to see. So, welcome. And then we have Jesse Jones. Jesse is a man whose life is a powerful testimony of redemption and purpose. After battling drug addiction for over 20 years, he found freedom through faith and recovery. Today, Jesse is the co founder of a recovery community organization in Minnesota called Lighthouse Beginnings, which is dedicated to helping individuals rebuild their lives. Through the organization's Day Center, Jesse and his team provide support for people facing mental health challenges, substance use disorders, and homelessness. In addition to his work in recovery, Jesse is a licensed pastor with the Assemblies of God and serves part time at Heritage Church, where he shares a message of hope, grace, and transformation. Welcome, Jesse. And then lastly, we have Dominique Buffett. Dominique Buffett is a Minneapolis based community advocate, mother, organizer dedicated to reimagining systems of care through love, dignity, and connection. She serves as a community partner with relationships, evolving possibilities, leading work around non coercive crisis response and family stabilization. Dominic's advocacy is grounded in her lived experience navigating housing instability, parenthood, and system barriers, and she uses storytelling as a tool for healing and systematic accountability. She has served in leadership and advocacy roles with Minnesota ICECI, Voices for Racial Justice, the Minnesota Child Defense Ambassador Program, the Ramsey County Children's Mental Health Collaborative as co chair, the Minnesota Suicide Prevention Task Force, and the Survivors for System Change, where she uplifts youth, families impacted by sexual exploitation. And welcome, Dominique. All right, so you can take it away, panel.
Yeah, thank you for the introduction. This is challenging for me. I'm unable to do the slides and the presentation. Oh, so Heather's going to do it for me. Okay, thank you, Heather, because that's kind of too challenging for me. So thank you all for joining us today as the moderator shared. My name is Pearl Evans. I work at the Minnesota Department of Health. I've been working here for the past 5 years, and I am joined by the Lived Experience Advisory Committee. And what we're going to do today is we're going to share with you our process of establishing the Lived Experience Advisory Council, and we're also going to share the impact. And so I'm going to get started. We've already done the introduction, so I'm just going to kick us off with the land acknowledgement. Next slide, Heather. And I'm going to ask one of the advisory members to read the land acknowledgement. In the state of Minnesota, we recognize our tribal partners and the lands that we are currently standing on. And so to do that, we read the land acknowledgement for all of our presentations. And I'm going to ask one of the advisory members to lead us in the land acknowledgement.
Every community owes its existence and vitality to generations from around the world who contributed their hopes, dreams, and energy to making the history that led to this moment. Some were brought here against their will, some were drawn to leave their distant homes in hope of a better life, and some have lived on this land for more generations than can be counted. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We are standing on the ancestral lands of the Dakota people. We want to acknowledge the Dakota and Ojibwe, the Ho-Chunk, and the other nations of people who also called this place home. We pay respects to their elders, past and present. Please take a moment to consider the treaties made by the tribal nations, the entities, non-native people to live and work on traditional native lands. Consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. Please join us in uncovering such truths that any and all public events.
Thank you, Letitia. And I want to welcome everyone in the audience to acknowledge that we are standing on, in Minnesota, we are standing on tribal ancestral land. Thank you, Letitia. And I'll run through the agenda very quickly here. We're going to start off with introductions that we have done. And then next, we're going to pivot to the Minnesota Department of Health Agency equity timeline. And then we're going to move into the overdose prevention unit's health equity process. And we're going to talk about the impact, and then the advisory members will provide some reflection on their experience in partnering with the Minnesota Department of Health Overdose Prevention Unit. And then we're going to have takeaways, and I'll share with you some steps to establish an advisory committee in your community. And then we'll also take questions and have a conversation with the audience. So thank you, Heather. And next slide, please. So we already introduced ourselves. So I'll start with the Minnesota Department of Health. Our mission is protecting, maintaining, and improving the health of all Minnesotans. And our vision is the vision of MDH is for health equity in Minnesota, where all communities are thriving and all people have what they need to be healthy. And our next slide will talk about how we operationalize this and MDH's commitment to health equity. Our process started back in 2013 through the Commissioner of Health establishing the Center for Health Equity, marking a significant step in embedding equity into our agency's work. And then in 2021, MDH advanced this commitment by creating the Health Equity Bureau. What does this mean? It means that MDH is composed of 3 bureaus, and by establishing another bureau that is dedicated specifically for health equity, it signals that equity initiatives are being prioritized across the entire agency. And in 2023, 10 years after the Center for Health Equity was established, MDH built upon this foundation by transitioning the center into its own division. And what does this progression tell us? It demonstrates that MDH's actions are intentionally aligned with our mission and vision. We are building out a robust health equity infrastructure designed to improve the health of all Minnesotans. Next slide. And our next slide I like to think of this as a breadcrumb because this is a lot of information. So our health equity is the why. It's the framework and the guiding principle that guides the Minnesota Department of Health's work. And community engagement is the how. It's the tool that makes equity real in practice. Next slide. And so I'll start with some common community engagement definitions. Community engagement, and we adapted this definition from the WHO Community Engagement Framework for Quality, People-Centered, and Resilient Health Services. So their definition is a process of developing relations that enable community members and other partners to work together to address issues and achieve positive impact and outcomes. And then we also have another definition from Dartmouth Health. Community engagement builds sustainable relationships through trust and collaboration, strengthening community well-being. The process should be enduring. That means it should happen over time. It should not be a one-off. And the process should be equitable and culturally sensitive to all participants with a shared goal of addressing the concerns of the community. And so that's what we're going to talk about in our presentation, how we have done this over time on the overdose prevention unit. So to align our efforts with the broader agency efforts, the overdose prevention unit operationalized its why. And we did this by in 2022 establishing a Health Equity Innovation Action Award. And the purpose of this award is to allow MDH staff to prioritize health equity outside of our normal federal funding. It allows our staff to be able to work with community, ask questions, build out, and be responsive to community needs. In essence, building out our community engagement and trust with community and being able to do initiatives and projects that are responsive to community needs. Because oftentimes, with the federal grant or other grants, there is always the objective is led by the funder. And this bucket of money allows MDH to listen authentically to community and listen for values, experience, and what does the community need. And so this bucket of money allowed us to do this. And this is very important because this is how we were able to operationalize health equity to improve relations with the advisory committee and the overdose prevention unit. So that same year, the overdose prevention unit was awarded a health equity bucket of money to conduct community engagement. And so what we wanted to do, we wanted to find out what did community members with lived experience know about the work that we did at the Minnesota Department of Health. Next slide. And so I'll break this down, operationalize our community engagement, the how. And so during the winter of 2023, the Overdose Prevention Unit, we facilitated a community engagement analysis. We learned from community what they know about us, what they don't know about us. And we were able to share with them some of the work that we do. And we wanted to also find out how the work that we're currently doing, how does it align with the community's needs? So we learned a whole lot from this bucket of work. And one of the most important things that we learned from this bucket of work, that community wanted to establish a committee that was reflective of them. So that's one of the key recommendations that came out of the Health Equity Innovative Action Award. And it allowed us to listen and learn why establishing a lived experience advisory committee specifically to the African American community was needed. And for one, it is because African Americans in Minnesota, they have one of the second highest overdose rates in our state. So in order for us to get a better understanding, to align our work with community knowledge, we needed to hear more from community on how to do this. And so with this recommendation, it showed that we not only listen for feedback, but we wanted to acknowledge and value and align our work. We wanted to be followed through with our commitment with action. And so to do this, the spring of 2024, the following year, we were awarded another Health Equity Award to establish the Lived Experience Advisory Committee. And this was transformational because we had one project with them and we listened and we learned and we said, you know what, we're going to follow through. We're going to find the money to be able to do this because we want to align our statements with our actions, and we want to build better relationships in communities. And so that following fall, in 2025, we operationalized the Lived Experience Advisory Committee. And when I say we operationalized it, we wanted to be intentional about this. So oftentimes when community folks are asked to participate, they are often given a gift card or something that is tokenizing, but we wanted to formalize our relationship. So we established actual contracts with the advisory committee. And we'll talk a little bit more about that as we go on with the presentation. So that following year, which is now fall of 2025, we got another recommendation from the advisory committee. And that recommendation was, why are we being brought in to consult and provide feedback on projects that are already done? And we thought like, yes, this is true. And we had to learn from this. How do we take this recommendation into consideration, locate funding in a time when there's a challenge to obtain funding so that we can continue to do the work that aligns community knowledge with public health practice? And so we'll get into that a little bit more. But we, just to stay on point, we did listen to that, and we wrote another application, a federal application, where we were awarded money to allow the Lived Experience Advisory Committee to continue. And so we'll talk deeper about that as we continue in the presentation. So I just want to sum this slide up with the message of everyone has a role to play, and building this relationship has a role to play in overdose prevention. And we align our actions with that by continuing to work with individuals from the community that have lived experience with substance use and other areas. So thank you. Next slide, please. So now we're going to get into the impact and the lessons learned. So as we're going to dive deeper into how we actually established the Lived Experience Advisory Council. So what we did to make sure that our recruitment efforts aligned with other social justice movements, we utilize relational organizing. And relational organizing is a way, it goes beyond just traditional outreach and invitations, because we didn't want to receive a whole bunch of applications and then have to evaluate whose lived experience we should select. So to build upon this relationship building that we were doing on the overdose prevention unit, we tapped into Letitia and Dominique, who had participated in our previous community engagement analysis. And then I utilized my network of folks in the recovery community to find out, who do you think would meet this criteria? We want this criteria, this advisory committee, to be representative of the state of Minnesota. So we wanted it to be individuals who were African American, who lived in greater Minnesota, who identify as LGBTQ. And we also wanted to make sure individuals who were 50 plus were also part of the advisory committee, so that we got an overall perspective of who is in Minnesota and how their lived experience can inform our work. So I'll turn it over to Letitia. I'll start with Letitia to talk about her experience in being recruited to be part of the advisory committee. So you can go back to that slide, because we're going to talk a little about their recruitment and the process, and then move to the next slide. So Letitia, do you want to chime in?
I got recruited by MDH through previous work with people that's connected to MDH in the community. So they use their networks to then build networks to reach people that they knew had lived experience. And I think the first selection process was just like people who have been in previous programming or who have been in partnership with MDA staff before, and then they broadened it to um other people in the community with lived experience, right? Like references or putting out flyers so that people could apply or explain to people what was going on. So it was kind of like each one teach one. Or I can't explain it, but it wasn't like I didn't know Pearl when I first started with MDH. So it wasn't like I was a friend of Pearl's and then I got the position. It was going through life situations, being involved in programming, being involved in other conversation with MDH or programming, and then being recruited for it. Right. So it wasn't an easy selection process. I didn't just get it because I knew someone.
But did this, Dominique, I'll move on to you. So as an advisory member, did you feel Did you feel valued as a partner and not as a participant? Can you talk a little bit about the partnership and what was different from being a participant in a focus group or something like that?
Yeah, I can. For me, I really did feel like a partner, more a partner than a participant when um the things you guys were asking were actually applied. Like instead of just trying to get information prior, like I felt like we were like at the table with you planning out, yeah, maybe not like the logistics in the beginning, but like at the end, like if this is really going to push through, these are some of the suggestions that we had and how MDH actually incorporated those changes. And so that felt more like a partnership to me rather than like just a participant where I could give you all these suggestions and views on how I felt or people that I would see in the community would probably feel. Um, and then not go anywhere. They were actually being put to use, which then made me feel like more of a partner rather than just a participant.
Thank you, Dominique. Jesse, do you want to chime in on your experience in being recruited to serve on the advisory committee?
Well, yeah, so actually I was recruited like she said, Pearl had reached out to a different organization, I think in the recovery community was from Steve Rumler Foundation, who then connected me and Pearl together. And then through the process of talking to Pearl, we didn't realize it, but we started talking, and then we realized, hey, we grew up in the same area, and we actually knew each other from previously, right? So that was just a nugget there. It's like, how do people come together through other people, and then you realize, and just being connected. And so when I was connected with MDH, and then I was recruited and basically given a chance to be on this advisory committee. I'll just tell you this. It felt like our voices were heard. We felt valued. Everything that we said, like they said, was taken into consideration. I think Pearl had touched a little bit about it in the beginning, where when they started the process off, and I hope I'm not jumping too far ahead with the beginning or at the end, and then we made some suggestions like, "Hey, why are you guys coming to us at the end? We should probably have a say so at the beginning." And so just being heard, right? And then also being considered a partner, right? Like it's not just here, let me give you a $25 gift card, a $50 gift card for your time or for your efforts in this, but hey, let's actually do a contract with you guys and let's actually bring you guys back, right? Because that's what they did. They reached back out and say, hey, we got an ongoing thing, right? So they value it. It just feels good to be valued, and the relationship that you're building and the voice, and right, just being the voice and changes that's happening around the community, around the state as well.
Thank you, Jesse. And so, Heather, you can move to the next slide. So we touched on this a little bit in your reflections and responses, but I want us to provide a little more context around the relationship building and how we did this. Dominique, do you want to start?
Can you repeat the question? Sorry.
So we want to discuss dive deeper into the community engagement skills. Like we talked about how you were recruited. So I want to talk a little bit more about the relationship building, the empowerment, and the community knowledge. And that, we talked a little bit about you're not simply partners in a public health initiative, but that you are helping co-create with the prevention team, so that you're writing your own story. So it's not like you're showing up in just MDH's story, but you are actually writing a story of a community that often has a hard time building relationships with the Minnesota Department of Health. But through this lived experience advisory committee, we are all writing our own stories of the work that we are doing around relationship building, community wisdom, and empowerment, and how that is being utilized alongside public health practices.
Yeah, most certainly. So like when I first started, I was like skeptical because anytime you heard MDH, you'd be like, "Oh, no, not MDH. They're going to deny or they're not really supportive. They're not really helpful." But come to find out, joining the advisory council, I found out what MDH actually did, and so many things that I work with, like in the community, like our harm reduction and all that, was underneath MDH, which I really didn't think MDH cared about the community until I got on the advisory council, and then was shown like, oh, we do care, but it's just more of like they're hidden, like a hidden father to all these organizations that I was working with. So I was broadly awakened, like to actually feel like MDH does care about the community. MDH is doing a lot for the community. They just didn't take that title, which was very impressive for me, like to see and understand.
Thank you. So as Dominique has said, like the state public health agency, um, typically is high level and part of the research and the evidence-based practices, but we were able to break this down so that public health can be visible in the community and work alongside of community members. So Letitia, if you want to chime in a little bit about community wisdom, the wisdom that you bring to this work in the advisory committee.
So I'm gonna kind of touch on what Dominique said. When I first joined the advisory committee, I didn't really know what MDH was. I didn't know everything that MDH had um their hands into, I would say. So I was able to go back and also share with my community members, the people who had lived experience, the people still struggling on the streets, the people still outside, on what MDH does and what MDH is doing already in our community. And I was able to open up um newfound like hope for people. Right now they're willing to talk about things more. They're willing to go into spaces and places more where they're like that MDH is connected to, and be able to give MDH in the community a chance to um collaborate more, to be more open to what MDH is saying and doing. And also because we're Black people with lived experience, we didn't much, there's not a lot of trust built. So to be able to go in and have a relationship with people in MDH, and them ask us questions, them really wanting to know, them taking our advice and our feedback and applying it to the work they're doing. And we can see that in community by the, like, like the numbers going up one year from the next, right? Or more Black and brown people being involved in MDH studies or things like that.
Thank you. Thank you. Jesse, do you want to speak a little bit about empowerment and how doing this work and the visibility and the connection with the Minnesota Department of Health? Do you want to talk a little bit about the connection and the visibility and the empowerment?
Yeah. I would just say, as far as like the connection and the visibility, right? Like when you bring this committee together, first as the connections, right? Like you get to work alongside of other people like Letitia and Dominique, right? You're bringing different people from different organizations and different walks of life together, and with some of the same lived experience, and we also are working together in that connection piece. But the empowerment piece is like when we're working with MDH, right? And they're doing a prevention piece and they're empowering us to utilize our voice and to say, hey, you guys are the experts here. Right. Because so many times when you're in a lived experience, they're not thinking, oh, that person is the expert, but they're actually taking a different approach and saying, I know that we're MDH, but you guys have the lived experience. You're the experts here. So we're here to learn from you. And they're empowering us to just speak our voice and to help out, right? And that's just a great feeling.
Thank you. Thank you. So yeah, that's part of the most important part of this work, in establishing this advisory committee. We have been able to make to break down what public health actually is, because you know, often individuals in the Black community, they really didn't understand what public health actually do. But now, Letitia, Jesse, and Dominique, they have been partnering with us, and they are able to see themselves in the work. And I think that is transformational as we continue to build future relationships, or continue to build a pathway for trust to actually take place between the community and the Minnesota Department of Health. And you can move to the next slide, Heather. And so another thing that we did, and we were intentional about this, and we're going to go into a little more depth detail about how we remove barriers for community to be able to show up, and be authentic, and be able to actually be part of the work, because we have been intentional, and we listen, and we understand that community members want to participate, but there's barriers. So I'll start with you, Jesse. Given that you live in greater Minnesota, speak a little bit about how impactful it was for you, for the meetings to be virtual and accessible.
I would just say the virtual part, because I am up in Brainerd, Minnesota, which is northern Minnesota, and because of my work schedule, I think that was just it was great, right? Like I could jump on the computer, I can be virtual, we all can have a good conversation. It just removed the barrier and just the financial piece of having to worry about jumping in a car, driving 2 hours, and getting to the meeting, or just being just situated there. So it removed a bunch of barriers for me to be able to allow me to be there over the internet and over the computer, but also like it's not costing me a lot to be able to get there, right? And so that was very, very meaningful for me and very helpful in my situation.
Thank you, thank you. And Letitia, Dominique, feel free to chime in here. I want y'all to speak a little bit more to the intentionality of the Wi-Fi stipends and childcare stipends and the planning time. And we wanted to make sure that folks were prepared for these meetings, right? So they were able to get paid for their planning of the materials. So just to give you an overview, someone from the staff, myself, would send the advisory committee members the project that we had plans to review a week in advance. And they will have time to go through the materials, get a better understanding of the materials, and be prepared to contribute to the conversation. And so, Letitia and Dominique, speak to how impactful it was to have these the established contracts, the planning time, the Wi-Fi, and the child care. Yeah, can you speak to that?
In our contract, we had time for preparation. Preparation just means, as she said, that Ms. Pearl would send out documentation weeks prior to our meeting, so that we have time to prepare, so that we know what we're talking about when we come to our meeting, so that we're not, like stumbling over ourselves, or, we have knowledge about what's going on, so that we can, you know, pour into the conversation. We also had in our contracts, written into our contracts, we had childcare stipends. So that means that for us who have children, even though the meetings were later in the day, that was also intentional, because people may have other jobs in the daytime. People may have other things to do. So our meetings were in the evening intentionally, so that people could be at home and settle down and be able to have time to sit down at the meeting without anything else interfering. And then we also had, like I said, childcare. We had childcare stipends where our children could be with someone else and then we can pay them for that. We also had internet stipends where we didn't have to pay for our own internet. Our internet was paid for um by the in the contract. We would invoice and then we would get paid back for that. Another thing was the flexibility in how we were paid, right? We could do checks, we could do direct deposit, we could do um other things so that we, because everybody doesn't have a bank account. Everybody doesn't, have um a way to cash a check without having to spend too much money, right? So everything in the contract we spoke about before to breaking down barriers, and they made sure that in their contract they put that in writing in words so that we knew what we couldn't. I mean, the barriers were broken down for us because childcare was a barrier, internet was a barrier. Not everybody has internet in their house, so those were some of the things that were done for us so that we could participate without the barriers being there.
Thank you, Dominique. I mean,
Oh,
Letitia. Um, Dominique, can you chime in on the established contracts and the planning time and how this made you feel as you continued to work with us?
like I was very, very grateful that like the things that we discussed before the contract actually came out. Like my barriers such as not stable internet, childcare, and just the timing during the day. Like I have so much other things to do, like for my children, that it was just not beneficial. So I liked how we had um, made it the evenings, but then it was enough time for me to get my sitter here and to get all worked out so they could have dinner while we were having our chat. But I also really appreciated the work, what we were going to be doing prior, so that way I could deep dive into it and actually like ask people in the community, like if they've heard of these organizations or if they had any feelings on these organizations or situations or what we were discussing at the time, um, and get also more of my community's feedback to be able to bring to the table to discuss with the advisory council, which I believe was amazing. Like, and it also got me more active into like searching out where MDH was and all these different campaigns and organizations and what they were doing and how I could make them better just by getting more of the community input. So I really appreciated all of that.
Thank you. Thank you. So this slide just speaks to how we were intentional and how we listened to community because we wanted this experience to be impactful. We wanted it to be transformative. We wanted to move away from the extraction of, you know, gift card or, you know, having meetings in places that were not beneficial for the community. And we also wanted to make sure that there was a learning that was taking place between the Minnesota Department of Health and the community, because many of the things that we have these complex terms for, like shared risks and protective factors, the community, we call it something else, right? And so we were able to exchange knowledge. And so, as Dominique and Letitia and Jesse mentioned, they were able to be empowered and continue to build relationships and their wisdom from the work that they are doing with the overdose prevention unit. Next slide, Heather. So at the end of our establishment of the advisory committee, we did a survey, and this is what we heard from MDH staff as they, responded to the survey and talked about what their experience with the advisory committee. Our team's conversations with the Black Lived Experience Advisory Committee helped shape our interview guide to something that was more practical, informative, and grounded in real world experience. So again, one of the the teams that brought forth a project for the advisory committee to review, they gained, their project was shaped by the advice of the advisory committee. So it wasn't just input, it was, they were allowed to contribute to how this would impact folks in their community. Um, the next quote is the direct input and feedback from the group provided us with valuable insight to ensure our marketing is relevant, motivating, and appropriate. Um, this quote talks about how, again, how this group brought in very culturally sensitive community knowledge to the work, which allowed Minnesota Department of Health team to get a better understanding of how to market materials. And this, the final one says, Black was so helpful to our team. They were passionate, engaged, provided excellent feedback. The group seems like they're invaluable to work in public health. And so, again, balancing out public health, breaking down what public health means in the community, and allowing community knowledge to align with that work. I think our team, we're learning so much and we are making an impact, and we're able to see this impact in the comments that we're hearing from our staff that submitted a project for review. Next slide. And so this slide talks about the advisory members, and what in their response to the survey at the end of the project. So I won't read this whole slide for you, but Jesse, Letitia, and Dominique, if you can chime in a little bit, and say what this slide meant to you. Yeah.
I can. This was like the bullet that says this was the start to MDH actually doing power sharing instead of just doing what what did they want to do. I really felt like this was power sharing. I felt like I was incorporated into the things, not just an outsider. Um, and it also gave me a positive space to be authentic as well, as the next bullet says. I didn't feel like I had to be in this little cookie cutter and just, like not swear or not say certain things because I didn't want to upset MDH. I really felt like I could just be open and free and be me, and speak my mind and what came to the top of my head at that time, um, which was really a comfortable and nice place to be. I don't get that in many other meetings, so like I really appreciate that with MDH.
So would you say this work was more transformative than other groups or community engagement projects that you have been a part of?
Yes.
Letitia, Jesse, you want to chime in a little bit here
Yeah.
about your experience on the advisory committee?
Yeah, I would just kind of second what she was saying a little bit too about just being authentic, right? You can be your authentic self and they just don't judge and they actually listen. Sometimes you get into an advisory committee and people will say, "Yeah, we want your opinion," right? And then they don't actually make the changes. But we actually seen that MDH does make the changes. They do want to hear. And it was a time where we were working on, I think, a prevention smoking thing, and we're working through it, and they just kept asking questions, and we were hammering it in and hammering at it and hammering at it. So it just feels like when you are a part of somebody that actually listens, but just don't listen, but then be a doer, then you're in a great place, right? Because a lot of people listen, but then they don't put the action into place. And MDH is actually putting the action into place, which tells me that we don't have to fear, or that there's a misconception about MDH about fearing and not caring, right? They actually care and they actually want to see changes happening.
Letitia, do you have anything else to add?
I would say that NDAs did a great job also like marketing us, right? Because it wasn't just not everything in MDH is always connected, but to get us to, speaking to other parts of MDH and other sections of MDH, really made me feel like we were important and that we were valued, and the asking questions, the being excited to talk to us, the just the way they valued us and made us feel like we were well important. Yeah, like the information that we were given was working, and bringing in other groups to speak to us and things like that. That felt very empowering.
So I'll just sum this slide up. So we have 5 different MDH teams and sections. We had the Justice Impact Epidemiology Correction Team share a project. We had the Tobacco Cessation Team share a project. We had a research project that we did with community for medication for opioid use disorder. We had them share a project, and then we also did some learning about shared risk and protective factors. So those are the projects that the advisory committee reviewed. And so I just wanted to give that synopsis. So can we move to the next slide, Heather? Lessons learned. Next slide, please. So now we're going to go into some of the lessons learned. And we kind of touched on this a little bit, but this slide will allow us to go a little bit deeper. Jesse, do you want to read this one?
Says, why are we being consulted after these materials are developed? It would be more meaningful to engage us at the beginning of an initiative that aims to address inequities and improve health outcome. To expand upon this work, projected staff need to begin efforts with consultants from people with lived experience. In its pilot year, most projects were already underway. While feedback was useful and able to be integrated in some way, it would be more impactful to start with community consultants in the initial design.
Thank you, Jesse. So do you want to chime in a little bit on this one and just say how this one speaks to you?
Yeah, so this one speaks to me because part of it, I think it was one of my recommendations, was like saying, hey, why are we coming in at the end when you guys are finished, right? I think we could be a little bit more helpful in the beginning if you tell us where you're going with our lived experience. If we come in at the beginning, we might be able to kind of direct it a little bit more and just help you get a better understanding and a better roadmap for it, right? And just to be able to hear, the experience and then before you put it together.
Thank you, Jesse. And so looking at the time, I'll just chime in here and add more context to this. So this is one of the recommendations that we got from the advisory committee, one of the recommendations. And so with this recommendation, we wanted to continue to be able to do this health equity and transformative work. And so another team, the human trafficking team, we've been having conversations around what does the intersection of human trafficking and overdose prevention looks like. And so my team, they applied for a federal grant. They were awarded the grant. And so they took Jesse's recommendation and wrote this into their federal application. And we were awarded this federal grant with RTI. And as part of that work, we are starting this I'm going to say the third iteration of community engagement with the community. And so with this new project, we're starting at the beginning. So we follow Jesse's recommendation. So and the name of the project is Minnesota Actions Research to Address Substance Use and Human Trafficking. And this is a federal partnership with RTI International. And so we have launched this project to improve the state's ability to identify victims of human trafficking who are also impacted by substance use. And this project aims to develop trauma-informed, culturally responsive services that meet the complex needs of individuals impacted by human trafficking and substance use. And there's a critical gap in the way that we collect data for individuals at this intersection. And so what this next iteration of the advisory committee is aimed to do, they have new contracts and they are going to be able, they're at the table now, and we are laying out the foundation of the questions, the data collection. What does this look like? And so I'll turn it over to Letitia and Dominique to chime in and provide some context on what it means to be part of the Minnesota Department of Health overdose prevention work from 2022 up until now, and then this next iteration of this contract that's going to go to 2027. And so, can you speak a little bit about this effort where you're being brought in at the beginning?
Yeah, I just feel like I'm very empowered. I feel like I can be of great assistance, and just eager to see like where things go from here. Like it really made me feel important, valued, and empowered all the way around. I don't know. Letitia, you want to add?
I can say that, can you guys hear me? I can say that it
Yes.
makes me feel, like Dominique said, very empowered, very important, especially because the reality of my life is that I'm very affected by substance abuse and human trafficking. So to be able to help create initiatives and do all these things, I really feel like I'm helping save the lives of my community members because um Minnesota was heavily affected by drug overdose and human trafficking. And it seems like everywhere I turn, one of my people are being affected or dying or whatever. So to be able to be brung in and help make initiatives, language, marketing, is really helping me reach my own community. So I feel great about it.
Thank you, Letitia. And in the interest of time, Heather, can we go to the next slide? So, Letitia, Jesse, or Dominique, if you can just speak to how we went from inform to consult and where you feel now in this spectrum of public participation, because we have moved from the initial extractive part of informing community until where we are now, where we're actually collaborating. Can you speak to that really quickly? Because we have 1 minute left.
We went from informing and then we went from actually collaborating, and then NDAs went to following directions or following um not directions, but
Listening to the community
yeah,
and
listening to the community, recommendations, following our recommendations, putting the action behind our recommendations and things like that.
next slide, please, Heather. And we don't really have time for questions, but I see that we did get some questions in the chat, and I will definitely follow up with the folks who requested more information about our contracting process and what that looked like. But thank you all for a great presentation. Thank you, Heather, for inviting us. And our work continues. And I'll end there.
Yeah. Well, I want to thank this panel. We could have used the entirety of the day. What a great presentation. You see the comments in there. So next up, we're going to take a lunch break. I would encourage folks to join that. We have an interactive poster exhibit. If you see the presenters in the chat, email them, talk to them, or chat with them to learn more. And then we'll come back together at 12:15 Central Time for our next session. So again, thank you for the great session. Take care, everyone.
Thank you. Bye.